I would like to introduce Ayana Shirai. She is a major, she's in the college and in Wharton. At Wharton, she studies healthcare management, and in the college, she is a philosophy major. So I'm really pleased to introduce her and her presentation, Thinking Beyond the Dilemma of Economic Efficiency and Basic Rights, a case study from health policy.
Thank you for the introduction, Dr. Anderson. So I'm Ayana, senior. As she said, healthcare management policy and philosophy. So I'm just going to be talking about me briefly before I begin. So yeah, as I said, I'm interested in actually many more things than these two, but I ended up with these two majors. One is philosophy, the other more healthcare management and policy at Wharton. It's something like an application of macroeconomics, but just to the context of healthcare. So for example, one class I'm taking this semester is called comparative health economics. So it compares health systems across the globe. So for example, Germany and Japan both have like a statutory health insurance that is universal coverage. Some other countries are more private based. Australia is a mixed. So we study those kinds of things and analyze them from economic perspectives. So that's one thing I do. And throughout my time at Paideia, I had an opportunity to even add to this part. So I was at Health Equity and Policy Lab at that Dr. Kruger runs. It's a Penn. She's a political scientist by training, but she also does a lot of work on the philosophical underpinning of what it means to be healthy from an Aristotelian point of view. So I was working there for a while. And when I was thinking about what to do for the capstone or for a senior thesis, I knew I wanted to do something that I guess obviously interests me a lot. But I wanted to do something that can integrate sort of theoretical interest with more applied issue. So I tend to have a natural tendency to just go for the appeal of abstract theories. I think it's what I just like. But I also know that, you can't be an armchair philosopher and just live peacefully without caring about other things happening in the world. Or at least that's not what I want to be. So I wanted to do something philosophical and theoretical and interesting enough for me, but also something applied that can have an impact beyond philosophy. So I guess with that, I was thinking of combining these two in my thesis, and that's actually what I ended up doing. So my capstone project is a thesis that I'm writing technically under Joseph Wharton Scholar at Wharton. So it's a research scholarship program at Wharton, and the students who are interested in doing independent research can find an advisor and work under the advisor. So I became a part of that program, and I did end up doing the research on a field that is considered, I think, generally philosophy of economics. So I ended up using philosophy to analyze the economics that I was learning. And the actual thesis ended up quite philosophical and actually not much applied issue, but today I'm applying my findings in the thesis to talk about health policy and what I think the thesis kind of has an implication for. So that's generally about me and how I ended up here. So if you allow me, I'm just going to quickly talk about the thesis and what was important there. So the actual thesis examined what economists consider to be rationality. So in talking about any sort of economic models, economists often say, we assume consumers are rational. Or something along that line, right? Like companies are rational when they maximize profits, consumers are rational when they maximize utility. But but I really wondered whether that use of the term rationality was capturing the essence of what it means to be rational. So my entire thesis examines the sort of de facto definition of rationality in economics from a philosophical perspective and argues whether it actually captured the essence of rationality or not. So in a formal, language, an agent is often considered to be rational by virtue of the structure that their preference fulfills within economics. And that's very wordy. But essentially what I want to say is the current form of rationality used in economics came from the development of game theory and decision theory in the early 20th century with people like von Neumann. And they showed that as long as the preferences that we have fulfill certain sets of axioms, like mathematical axioms, we can actually assign utilities to those preferences so that we can model agents as utility maximizing. So that's the main part. But what I want to say there is actually the preference structures tend to be very strict in some sense if you want to consider what's rational in ordinary languages, but also very loose in other sense. So that's what I'm going to explain here. So often the preferences are supposed to fulfill things like completeness. So it has to be either that this is indifferent. So for all the things, we have to be able to say we are equal in preference between the two, or we prefer one over the other, like strawberry over the apple, or we are indifferent between the two. And we also have to say preferences have to be transitive, which means if you prefer apple over strawberry, strawberry over lemon, then you have to prefer apple over lemon. And then the third part is called monotonicity, but it just means that 3 apples is assuming that apple is good or apple is something preferred. 3 apples is better than 1 apple. And then the last part is irreflexivity. So it just means if you consider these two as the same bundle of goods or the same thing, then your preference towards them is also the same. So I think those things make sense when we hear the words for the first time at least. But if we examine different cases, they actually turn out to be not so important for rationality, or they just seem to be off a little bit. So what I might mean by that is the following. In my thesis, I ended up talking about the economic concept of rationality being under-inclusive in some sense, and over-inclusive in other sense. So under-inclusive meaning they fail to call someone rational as rational because of these strict preference structures, and then over-inclusive in the opposite sense of they end up calling someone irrational as rational. And that was important for me, at least in my philosophical argument. So I'm just going to bring one example. Or two, I think I have time. So for under-inclusivity, they fail to call this thing of 3 apples is always better than 1 apple, fails to capture someone like a Buddhist monk who doesn't have a preference of having more and more and more goods. But we can conceptually imagine a perfectly rational Buddhist monk whose preference, what's important for them or whose value reflects just that they have enough to meet their needs, and that's the thing they want to satisfy, but they're not going to be happy with 3 more apples, or, if they're satisfied with 1, then 3 more apples can actually be worse for them than 1 apple. So this part seems to be too restrictive in one sense. And then in terms of over-inclusiveness, one thing that I haven't mentioned about the economic rationality is that in addition to these 4 things, they also think that these preferences are revealed in choices. And it's because economics tends to construct models on observable traits, but it really limits our understanding of rationality to like what can be observed by other people. So it's not about what can be in our head, but it's more about our behaviors, which end up being over-inclusive. So what I mean by that is the following. So for example, if we think of someone who, let's say, like slightly overweight and wants to lose weight for health and tries to buy like healthier or more nutritious food at grocery stores, but the person, let's say, like end up getting more snacks because they're sort of succumbed to temptation, or because they just see the snack and then they feel like they just want to have it. But then let's say that person regrets that choice afterwards and thinks to themselves, like, I was so irrational, like, why did I do that? Why do I repeat doing that? And I think this is a very common thing that we observe in ourselves. And that's what philosophers tend to call weakness of will or aprasia. So they tend to succumb to a temporary desire and let go of something more important in the long term. And that's supposed to be like a hallmark of irrationality, but economists actually call these people rational as long as, let's say, like they're coherent in their choices, right? Like if this was snack choice and then if this was, let's say, like grains and vegetables or something, as long as the person keeps choosing snacks over these consistently, and as long as these kinds of things are kept, they end up calling them rational. And I'm like, no, they're not, right? So that's my point. So those kinds of things are what I did generally in my paper. So just examining the definition case by case and thinking whether it really captures rationality or not. So that's the bit about my thesis. So now I'm going to be talking about how this connects to more applied issues. So one thing to note is that, you know, you may think rationality is not something that ordinary people are interested, right? Like philosophers really are interested in rationality from like the time of Plato, but no, like ordinary people, maybe not. They tend to think like, who cares if I'm rational or not? But I actually do think the concept of rationality is crucial to understand or have better political conversations. So what I mean by this is, for economics, a lot of economics, it's supposed to be like descriptive, or they aim to be descriptive in the sense of they aim to describe the world, right? But I also find many economists making normative claims or claims about what the world should be. And I think rationality is one of the things that bridges from descriptive to normative without much justification. So for example, they can say things like, as long as they are rational, then that can lead to justified individual choices. And economists often equate the result of individual choices to what they call welfare. Right? Like I don't know how much you've learned economics, but they tend to speak of welfare in terms of like the basic demand and supply function. So that's demand, supply, and they shift the demand up, or meeting those demands is considered welfare, and the same for suppliers, right? Like this, okay, they just mathematically think of these as representative welfare, but they cannot argue for these kinds of economic welfare if either rationality assumption or individual choices are always good assumption or broken. And I think because rationality doesn't seem to be what economists tend to call rationality, we have to be more careful in assuming those things, at least in, you know, many contentious political contexts. So that's my hunch. And then now I'm moving on to how this is more or less reflected in health policy. But before I do that, I do have a QR code as well with this short survey that I wanted to use for this latter half of my presentation. So if you could, okay, I think I got everyone. So I'm gonna start talking again. I'm gonna bring up the survey responses in a moment, but let me just set up how I'm thinking about this issue. So as the title of my presentation suggested, I'm thinking about an application of my thesis to a debate that's often framed in terms of sort of economic efficiency versus rights, or more specifically, rights to health. And this is a kind of debate that we tend to hear in considering things like universal health coverage, which is just health insurance for all people, at least for like basic primary care. And in thinking about whether we should have universal health coverage, we tend to then go into the debate of should the government provide the insurance or should the market actor, like just, Blue Cross Blue Shield or Aetna, should they do it for everyone? And that tends to be the debate. And an empirical survey actually shows that our country, the United States, is quite divided on this issue in terms of partisanship. So we tend to see more Democrats voting for or expressing their opinions, where you see in terms of like, yes, the government should create a single insurance plan, and Republicans tend to say, no, we should go for a market. And when we observe that in the academic context, I actually heard a lot of my econ professors more going for economic efficiency. And then I also heard people at the Health Equity and Policy Lab, or people more in like the medical field. So people like in public health, people in doing medicine, those people tend to just say rights to health is important, and that's the reason why the government should provide. And I actually feel like this debate in framed this manner is a little bit of a stalemate. Like, I think we're passing each other in talking about this issue. And it's because, on one hand, people who like economic efficiency tend to be assuming this thing that I just talked about. They think all agents are rational. They think they are just making individual choices under freedom. And satisfying these choices is the welfare, and the market does the job the best. Pretty logical, as long as the assumption holds. So that's one party. But then the other party just tends to say, no, we just have rights, and the government should provide anything that's required to fulfill the rights. Even though it makes sense, I think talking about things in terms of rights come a little bit with a downside, in the sense that rights are, by definition, supposed to be absolute, right? We cannot really talk about what's the best thing to do if we are just talking about all the things that are absolutely important. And what I mean by this is the following. So for rights, they can just say right to health is important, but then these people can also say right to choice is important. How are you going to decide which one is more important, right? As long as we take anything to be absolutely important, we face a problem of like comparing two things that both seem like intrinsically or absolutely important. These kinds of debates also manifest in thinking about things like rights of the indigenous people to pursue their culture, and like animal rights, right? Like, should they have hunting rights? It's right versus right, and I guess we are just puzzled. But we need to have a dialogue and overcome the puzzlement, or that's how I think about it. So that's where I want to bring up another part of my thesis. So in my thesis, I not only examined the definition of rationality, the economic rationality from a philosophical perspective, but I also compared it with what's tend to be considered as and standard definition in the action theory literature in philosophy. So action theory is a subfield of philosophy that examines human actions, I think, obviously. And it examines things like, what is an intentional action? Or how does intention connect to our reasons, like the reasons we do certain things? Or how does it connect to motivation? Or how does it connect to moral judgments? And it tends to be important also in fields like law or just court cases, like examining court cases, because intention matters a lot in those. So I had a chance to take a class in action theory in fall this year. Well, I mean like last year. And I brought up a definition of rationality from the action theory literature. And I ended up thinking that we can use that definition in the conversation like this and advance the dialogue better. So for the earlier rationality, it was all about preferences, right? And it was all about preferences fulfilling certain axiomatic constraints. Philosophers tend to think about rationality in terms of reasons. So they tend to say an agent is rational if they take an action supported by all relevant reasons. So it's pretty simple, but it actually is quite important that we think about action in terms of the reasons that support them and calling them rational. So for example, going back to like a person doing grocery shopping case, if we want to call them rational, we need to say, if we want to call them irrational because they fail in rationality, we can just say, no, like all the relevant reasons, like the desire to get healthy can be a reason. Like I want to get healthy, or I want to just appreciate my body, or perhaps things along that line. Those reasons can all enter into one's reasoning about the action and support certain specific actions, right? Like to actually buy stuff that are nutritious. So this is the philosophical definition, and compared to economics, I think it at least does a better job than the preference-based model. And further, I think thinking about rationality in this way can help us have a dialogue. So if we think about rationality in this way, we can use the normativity of rationality in our dialogue itself. So rationality often is taken to be a good thing. Like, or by definition, it's supposed to be something desirable. I want to be rational, and I think you want to be rational if you could as well. Perhaps we fail, I do fail, but it's supposed to be a good thing. So if we want to have a rational dialogue with other people in this kind of health policy context, instead of going to things like just efficiency and rights, I think we should just start thinking about reasons to have health insurance and just go through all the relevant reasons, and also do the same thing for all the reasons to have a market in the system. And then with all the reasons on the table, compare. I think it allows for more nuanced discussion than saying like, right is important and the choice is also important. I know both are important, right? So that's not, I think, paying attention to all the relevant reasons can go very far. Right, so just to bring up the survey. So most of you, maybe except for one person who chose maybe, said all people have rights to health, right? So we want to generally support this. But then I think all of you also supported promoting the research on discovering like cure or prevention for otherwise incurable or hard to prevent diseases. And this actually tends to be an argument for efficiency-based view because market tends to promote innovation. So we have to say, like, to an extent that market promotes innovation and R&D in pharmaceutical company, we may actually want to have a strong market. And it is true that if we compare the US healthcare system with other countries, yes, they tend to be inequitable compared to, say, Canada, but they also have a lot more innovation in this country, and that is the truth. So we have to then say, okay, the drug's important, new drugs or innovation, and then everyone's access to health important, and then we'll have to see like which reason has more weight in this specific context for this country, instead of just saying efficiency is better. Further, another question that I had was whether spending public budget wisely or efficiently is important, right? It's also a reason here, but it can lead to further actions on the market side because it actually is a problem in my home country, Japan, but when the government starts taking care a lot of the welfare system or social safety nets, we tend to start facing like administrative issues or like bureaucratic issues on the side of the government, and it makes things like an implementation of EHR, the electronic health record, very hard. And in those dimensions, like this country is doing much better than say in Japan, where hospitals are still using faxes and telephones, and it's like, but no, it's very hard to move on. So in terms of efficiency, we may actually have to delegate some parts of the healthcare to the private actors so that they can efficiently manage resources and also lead to innovation. And next, so another thing so the last two questions were supposed to be even more underlying like philosophical questions about values. So in one question I asked whether you believe certain things are universal to all human beings. And in the other question, I asked whether each person is the best judgment of choices for themselves. And for these two questions, the results are quite mixed. So for the first one, about half of the people said, yes, there are values universal. A quarter said, no, there is not. The other quarter said, maybe. And then for the other one, about whether each one is the best choice, each one can choose the best for themselves. There were no yeses, but a great number of maybes. And also, I think about a third of people chose no. So for these questions, instead of bringing it to the debate about healthcare, I wanted to use those things to close off. So these questions, the last two at least, are not something that we are meant to have an immediate answer, I think. And I do want to have an answer to find out whether there is actually something universal that I can say I should promote it for every single human being on the earth. But it also is very difficult to make that kind of an argument to say, like, health is absolute, or even without health, like, choice is absolute or freedom is absolute. And wanting to believe that doesn't make it true, at least immediately. So this is a kind of thing that I tend to get puzzled about, but also excited or interested in when thinking about those things. So what I want to say here is, going back to the health policy debate, the rights talk generally assumes the truth of the universal values. The efficiency talks assumes the other one of individual being the best judge for themselves. And I think neither of these assumptions are, at least philosophically, proven that much, and we can still disagree about those things. And in these contexts, I think in the face of disagreement, what's most important is to try to listen to the other party and have a dialogue. Or that's what I learned in the Paideia program. And with that, I think an insight from philosophy of considering all the specific reasons and seeing the weight of reasons that support one action over the other, or perhaps the alternative, and see what is supported, all things considered together, could be a way to have a better talk about things like health policy in this country and beyond. Because just having a debate sometimes doesn't feel quite right as a way to approach another person who is wanting to talk to you. So I think that's it. And I'm happy to take questions if you have them.
I mean, I'll start with questions. First of all, I really like this a lot. It's really, really well done. I'm wondering, because I really like your approach that says that maybe if you just choose reasons, you can have a more effective conversation. And I wonder if you thought at all about, will that work only for the kinds of issues where you can ultimately come to some kind of compromise? And are there some issues where it is a yes or no kind of answer? And for healthcare, I think you actually could do this, and the resulting system could be some kind of a hybrid or something like that. But where does the role of what this works for and what it doesn't? What kind of policy issues do you think it would be effective for? Or maybe there really aren't policy issues that are black and white, but feels like there probably are some.
No, yeah, that's a very good point. I do have the same sort of skepticism for applying this kind of thing to things where the outcomes are supposed to be dichotomous or like two options.
Maybe ask it a different way. Do you think healthcare is one where you could come?
I think healthcare is actually one where we could come. But in order to go there, we have to expand the options of the actions in our conversation to many more nuanced policy options, I think.
Yeah.
Just saying like government versus private is, like there are many more ways that we have. Like for example, Japan is half government publicly supported but also provided through employers, right? So you register through your employer, but the funding also comes from the prefecture, like kind of like a state and the government, the federal government. So there are many midways. So as long as we can think about the midways, I think we can come to at least use reasons for a better conversation. But yeah, for things like, say, abortion, those kinds of things, I think tends to be very hard just because the concept itself tends to be tied to something absolute like right or life.
Yeah.
And I honestly don't know, but still there, I think listening to reasons can be useful in the sense that it may not lead us to a good compromise, but it, I think, helps us understand the other side better. Just because, you know, there could be beyond saying like a choice is important, right? Like a choice is important because there are those kind of people who go through those things, and that's the reasons why choice is important. And there are many more stories and nuances we can add to things as plain as it seems, like things like choice is important. So it can have many meanings, I think, and we should talk about those meanings.
Thank you so much, Ayana. I'm wondering about rationality as a kind of absolute value, right? And what you're saying right now about like, well, if you hear another person's reason, if you understand how, in their view at least, their feelings are rational, their beliefs are rational, right? There's a philosopher, I really like Marilyn Nassim Sabat. I don't know if you have seen her work, but she was a clinical therapist working with addicts for a really long time. And she talked about that, like that weakness of will idea, and really pushed back against it. And her thing was like, look, for a person, you know, they are always operating according to what they truly in that moment believe is their best interest, even if they immediately regret it, even if they 5 minutes later wish that they had done something different. Like, if we take for granted that like people are always operating according to a logic that feels right to them at that very moment. And so I wonder about like all the subjectivity that I see, you know, like relevant is so subjective, right? And rational is such a subjective idea. And I really like how you are sort of troubling that. Like, what does rational even mean? And who comes up with these terms for what purposes? And it seems like the sort of classical economist idea of rationality just has more to do with consistency than a process of decision making, the way that you're saying it, right? Like, as long as they always do it the same way, they're calling it rational, but what they mean is consistent. So yeah, I don't know if I have a fully formed question, but I guess I'm just wondering about rationality as the sort of key idea, and what it means to take rationality, relevancy as themselves sort of absolute values or ideas.
Sure, no, I love your question and the insight. For the weakness of will stuff, I actually talked about the philosophical view from borrowing from a person called Donald Davidson, a very famous 20th century philosopher who started the field of action, or revived the field of action theory along with Elizabeth Anscombe. So Davidson has a particular view about rationality and irrationality, or weakness of will, as a sort of irrationality in terms of reasons that can cause an action versus that can justify an action. So that's his whole theory, but it's actually not the only view on the table to think about weakness of will. So I thought you may like a work by, I think, called, I don't remember the first name, but the last name should be Holden. He has a slightly different view on rationality, still functioning in this kind of way, but thinking about weakness of will as an instance where you deliberate or you change the result of deliberation in a context where you shouldn't have changed. So I thought it might be somewhat similar to yours in the sense that you're always operating in some sort of manner that makes sense to you, but there are times when you should change your mind versus there are times when you shouldn't change your mind. So that's an alternative view that I wanted to introduce. But in thinking about rationality as an absolute, it's a very difficult question, I think, and I don't know if I have a fully informed answer, in the sense that I do generally think, like, as a person who loves philosophy and who loves talking about these kinds of issues in a very nuanced and careful manner, this seems like a great thing. But I'm also aware that not all people have the privilege to be rational, in the sense that promoting rationality too much can also come with a form of like ableism, in a sense of like I ended up being here, but I also know that I probably came with great luck at the birth of having certain cognitive capacities, and luck growing up and having good education, and also being at Penn and being able to take classes, and this is a privilege that not everyone can afford. So I don't want to impose rationality on other people, but I think this is something that I would like to personally try to use in situations that appears well. And if people are also so willing, like, reason-based sort of dialogue is something that I would like to engage with those people. But I don't know if I can say it's like an absolute.
That's a really thoughtful answer.
Yeah. Ayana, do you have a sense of what it might take to help people move away from their comfort zones of, I talked about rights and I talked about efficiency, to have this relevant reasons discussion? Like,
Yeah, something that I haven't talked about today yet is like where I'm heading like after this thesis. I am taking a gap year to apply to grad school, and I would like to go to a philosophy graduate school to pursue these kinds of matters further. And I want to work in action theory that I just said, plus also meta-ethics. It's about the meta level questions of ethics. So things like, are there objective values, or what kind of statuses, existential statuses, the normative reasons have? There's a bit of like theoretical philosopher in me is excited, but so those are things I'm interested in doing. But alongside with that, this idea about talking beyond categories or like dichotomous debate is something that I had been thinking even before I actually ended up writing the entire thesis. And if the time allows, during my gap year, I wanted to develop a platform where people could imagine policy options on a spectrum instead of like a categories. So I wanted to make something like a website or software where people can like slide instead of choosing one or the other, and have supporting reasons beneath them for every sort of like spectrum that they can choose. And I think that sort of visual mapping helps, at least for me, and I'll see if I can do it. But that's one idea that's yet to be explored.
I hope you can do that. That's great.
following up on that, last year when I was at the Stavros Anarchist Foundation conference, they had actually the SNF Agora program at Hopkins had zoomed in, and now I'm not remembering the minister's name, but somebody from Taiwan who does a lot of these more grassroots online tools for supporting policy and getting people. And anyway, so that I'll see if I can find the name and share it with you, because they wrote a lot as well. And to me, it may not be the same technical thing, but I think they're trying to do a similar thing, get people to think in more complex ways and use data from the local context to drive policy and government decisions and deliberation.
Well, will you join me in thanking Ayana Shirai for this wonderful. She always is pushing the boundaries of knowledge, as you can tell, and this reminded me so much of an early thing you did for us when you talked about the theater of the oppressed, making really difficult philosophical ideas very accessible, and you did it here as well. So thank you so much.
Yeah.